wonderful evening to you, lovely people. Welcome to PM Personality Profile. My guest tonight, he is a fellow of the Higher Education Academy of England and Wales. He is a research practitioner in health promotions with speciality in national and social health insurance schemes. Currently, he is the CEO of the National Health Insurance Authority, Dr. Dacosta Aboagye. My guest, so excited to see you. And congratulations, it's in order.
Thank you, Aisha.
And I see the fire with which you've started. We've seen some good things, for instance, that free dialysis treatment. We haven't seen this. It's actually good news, but the question many ask, is it sustainable?
Aisha, thank you so much. I think, yes, it is sustainable. I have looked at the numbers. Maybe sustainable in another form.
Okay.
But what I know is that government do have a comprehensive plan for not only kidney diseases, but chronic diseases. So, you know, kidney disease is just one of the chronic diseases. And looking at the fact that the non-communicables seems to be the next pandemic, you really want to tackle all. Without isolating it.
Right.
So this was just a temporary measure as we rolled out the comprehensive plan. That's why, and on the National Health Insurance Scheme, when you are adding something, you do it gradually. You don't just add on. It takes a lot of time or a long time before you are. So, for example, we do have mental health, we do have others that people are advocating that we add it on. Okay. But I say we've been going through it stepwise. But this one, we needed to take action because obviously it had been in the media for some time and there were a lot of public outcry for it. We just needed to be pragmatic to see what we can do in the interim whilst we looked at the actuarials to see how sustainable it is and what form it will take if it is. But what I can assure you is that there is a sustainable plan for not only chronic diseases, renal diseases, but chronic diseases.
Okay, so I've seen that you've released, you've paid arrears to healthcare providers. I mean, a lot of magic you're doing there, and this 6 months dialysis thing. I see that you have a comprehensive plan. Share that plan with me.
Okay, so thank you so much. So as you said, so my specialty is the National Health Insurance Scheme. In fact, I did my PhD at the Leeds Beckett University, but my research was in Ghana, studying the National Health Insurance. So since 2010 till now, I will say that I've spent a lot of time studying the National Health, and I have a lot of publications from the National Health Insurance point of view, or from my research. So, I mean, once I came in, I knew that there were some few gaps that I needed to obviously address. Some to me were very administrative, and which I could easily just address it head on. So I came in with a 4-plan agenda. The first one being that our visitors coming to this country should at any point should have insurance. So there must be a mandatory insurance for visitors coming in here because when they come in they are not well, sometimes they struggle. So all we have to do is to designate some good facilities for them and ask them to have insurance so that when they come in they are not well, we can. Again, what that will do is to bring in more resources for the scheme. And we want to achieve universal health coverage, and it means that everyone should be covered. So the second point, which I will link with the first one later, is the Ghana card. You see, when I came in, obviously we looked at the database and we saw that we had about 6.3 million young people between the ages of 6 and 14 on the database. We were going to print our NHIS card for them. So what we realized is that if we are saying that from 15 years and above, your Ghana card is now going to be your NHIS number, then why then do we have to issue the cards, that's our cards, for those between the ages of 6 and 14? So what Parliament approved for us, we decided to inform the Health Committee that we want to see that money to the National Identification Authority to print the Ghana card for these young people. Now, Ghana Health Service is also doing number at birth, so 0 to 5. Now, if we do 6 to 14 and already 15, then it means that by this alone, we would achieve universal health coverage, even maybe before the 2030 agenda.
Okay.
And what this means is that everyone will have access to healthcare. But there could be barriers as well. So if you look at it, I mean, the informal sector is our biggest problem because they need to pay premiums. But the premiums that they pay and the fees that they pay is insignificant on our budget. So it means that gradually you have to now start to withdraw those fees, that 8 cedis, to give people access to the scheme. So what we did was, obviously, once we have the Ghana card for everyone, then we will just remove the cost component, which is the 8 cedis. Then it means that every Ghanaian will now be automatically a member of the scheme because your NHIS card is now your
linked with your Ghana card. Okay.
Luckily, SNIT, NHIS, and NIA do have integrated database.
Yeah.
So in this case, it just means that obviously you need all you need is the Ghana card to access healthcare. So once you do that, it means that you are actually reducing the barriers to accessing healthcare for Ghanaians.
Okay.
And you are making the scheme attractive to everyone. So once we do for 6 to 14, then everybody will have it. But between 15 upwards, we also realize that SNIT contributors are within that bracket. So we noted that for SNIT contributors, they pay actually through their salaries. That's 2.5% of their salary.
Okay.
So quickly, through government, we said that no, we couldn't really let them pay the 8 cedis because then they are double paying.
Yeah.
So we just had to remove the 8 cedis for the SNIT contributors. So currently, the process is ongoing. In fact, some people have even received text messages that automatically they've been enrolled as members of the scheme.
Okay.
And we have actually abolished the 8 cedis for all SNIT contributors. So that's because we thrive on equity. So in this case, we are being fair. We are not obviously cheating them because they've double paid since 20 years. And I think this is the time for us to give them some relief for them to be. But once you do this, you see, you increase the membership as well. You see, you make it attractive to them, for them to access healthcare. So that's the second point. Now, the third aspect of my vision is, since the inception of the scheme, we've been 20 years now.
But before you give me that, the NHIA, with the problems we're facing, with people getting their Ghana cards and what have you, don't you see this as a barrier to your plan?
No. In fact, I see that as rather very positive in terms of it's easy for us and it will help us. The challenge could be financial. So as long as we have the money, that we are seeding the money to them, then it means that between the ages of 6 and 14, they will easily have the cards. So we are starting, I think, from the 17th of this month. We'll be going to schools to do it. Because at the end of the day, if we left it for NIA, then it means that it could take time. It could be even 3 years before they finish. But once we have the money and we say, okay, we are seeding the money to, then in that case, they will produce it, it will fast track it. So that makes it easy. Okay. Yes, that makes it easy.
All right, so you're telling me about your next leg of
yes,
the plan.
so You see, for the last 20 years, the scheme has been focusing on what we call the curative services and also other services. But there is no insurance scheme that will survive if you are not funding what we call the determinants of health, which actually falls on preventive medicine. So in this case, next month, we believe that we need to introduce the preventive health care. Now, I told you about the non-communicables, the renal diseases and all those. Yeah. Let's address it from the start.
Okay.
If we do use the preventive approach, which means that, I mean, our forefathers told us that prevention is always better than cure, just that we've not been practicing it. So if you use that approach, it means that you will not even wait for people to get these non-communicable diseases like hypertension, diabetes, renal diseases, and the stroke and the others before they get access to healthcare. But you are preventing it. So what we want to do is to introduce the preventive aspect where we give every Ghanaian the opportunity to go to any healthcare facility of their choice to do a medical check once a year on their birth month.
Okay.
On their birth month.
Okay.
Dr. Aboagye is chairing that committee. Very soon it will be completed and we roll out. That's part of the comprehensive plan that I've been talking about. You see, because once you do that, then it means that you are also reducing the cost burden on curative services for the NHIA. Again, you are also increasing life expectancy for a lot of people. And again, you are enticing members, citizens to be members, because at the end of the day, I remember in my research, some Ghanaians were saying that they do not benefit from the NHIA, so why do they have to pay? So once you give them this incentive of preventive medicine or preventive health care, then it means they've benefited, so they will be willing or they will be content when they are even paying either indirectly or directly. So again, the Sustainable Development Goals do have an aspect of wellness. So it's health and wellness, which is goal 3. I mean, health do have wellness in, but that wellness there, I was fortunate also to be part of the Sustainable Development Goal when we were moving from the Millennium Development Goal because of my supervisor. So the wellness there actually was put there for a reason. It was geared towards health promotion. In some countries, they measure it by happiness. In other countries, they measure it by the physical wellness or the mental wellness. So many, depending on how you want to look at it. So, but wellness is a whole package. So, if here we do the preventive health care through the wellness centers, which is each facility having a wellness center where citizens can go there for these checks, plus counseling. And it will actually address the goal 3 of the SDG, which means that obviously we are meeting those goals as well. Then the final one is, we've noted in the scheme that we are paying huge amount, as you said, but facilities keep charging. So I invited the stakeholders, and when we met with them, they said that the tariffs are too low. The tariffs in terms of the prices of medicine and they are too low. So they will need a review. So immediately what we did was to set up a committee, which is the strategic question unit. They brought all the stakeholders, including the facilities themselves, to review the tariffs. Now, when they review the tariffs, and I believe that we should give the facilities and also the pharma companies some form of guarantee. So in other jurisdictions or in health economics, we have something we called automatic price adjustment. So you look at the prevailing economic circumstances and adjust the price as appropriate. So I'm recommending that we should have what we call the National Tariff Review Committee, so that anytime, depending on the economic circumstances, when prices go up, the National Tariff Review Committee will meet and review the tariffs. By this, you'll be giving the facilities the required amount of money that they need in terms of the tariffs.
Yeah.
When you do that, then the facilities will have no moral right to charge our clients exorbitantly, even though it is illegal for them to do it.
Okay.
So we are working on it to see how best we can do that so that they will have that guarantee. But I think we will need parliamentary approval because in our act, it says we should review once a year.
Okay.
So once you are able to obviously seek parliamentary approval and obviously remove that clause of once a year review, then you set up the National Tariff Review Committee, then it means that you'll be addressing the issue of co-payments.
Yeah. And
again, by this, you see, this is where I also talked about reforms, because you see, reforms in the NHIS is very important, because the scheme, since the inception of the scheme, the money has been going through GRA to the consolidated fund. To me, that is not right. You see, the money should go through GRA. It should be transferred directly to the NHIL account. Once you do that, you cut all the bureaucracies so that the NHIL, because that's what the funds were meant for, so that you'll be able to use the funds for. Once you do that, the funds is sustainable over many years, and we can cover a whole range of diseases. And with this, I think the scheme will be in a very good footing.
And I'm happy you talk about funding, because in all this beautiful plan that you share with us requires a lot of funding. And you say you have the money. Where are you getting your funding from?
The Act actually makes it compulsory for the funds to be given to the NHIL.
Okay.
Because it is people's money. You sit in there. When you buy anything, you pay what we call the National Health Insurance Levy.
Correct.
Indirectly. SNIT people are paying 2.5% by the year. So definitely, the money should be given to what? The NHIS.
So, yeah.
To make sure that we pay the claims. So the problem is not about the money, but it's about the releases. So if government is able to do the releases frequently, as they are supposed to, then there wouldn't be any problem.
But you have the money sitting down right now. And the question is, I mean, that fund has been there all this while. How come now the money is coming?
No, if you say you have the money,
wasn't coming.
No, if you say you have the money sitting there, the money is not sitting there.
Okay.
So that's what I explained. So the money comes in, but it goes to the consolidated account. It needs to be vetted, because once you do the NHIL, it needs to be vetted.
Okay.
So once it's vetted, it takes time. So my suggestion is that we should rather, it should go from the GRA straight to
the
NHIL, not the consolidated fund. Because a lot of this goes through to the consolidated fund because it gets to us.
Yeah.
So all those bureaucratic processes must be obviously scaled down. So it will need a review of the Act. And this is why I'm really happy that at this time I'll be championing it, because at the end of the day, I believe that this is what will help. And I've been communicating to government, and we are working on it. And I think I have a strong belief that I'll succeed. I mean, more recently, we've paid over 300 million to facilities through hard work. So I believe that certainly we'll be addressing some of these challenges. I really believe you'll be addressing some of these challenges.
Many say that you're putting in all of this because it's an election year. The example is you're giving dialysis for free for 6 months. If this is something that is so important to us, why give it for 6 months? Why not forever? So they feel that these freebies won't last.
Okay, so thank you. So I just want to dispel the fact that I have no political motives for proposing to government that we should do this free dialysis.
Maybe government is giving you the money quick
no,
because it's an election year.
I don't think so. You see, before government can act, NHIS must advise government. Okay, we must, because we need to see whether our scheme is sustainable or not. Okay. Because if government says that I should do it, and I believe that it's not sustainable, I'll communicate to government that it's not sustainable.
Yeah.
So, and I'll tell you now what happened, the reason why we are introducing this dialysis. So, at the time when I came in, dialysis had actually become very topical in the country. So, I was going to Parliament. So, when I was going, I actually visited Dr. Dacosta Aboagye, and I said, Doc, the fact is, dialysis has become very topical in the country. Now, what can we do? Because at the end of the day, we really need to see how best we can support the vulnerable and the needy, if for anything. So he asked me for the data. Then I said, okay, I can produce some data, but the actuarial, that's the bigger actuarial, is now being done. So he requested for the actuarials for the vulnerable and obviously what we can. So I gave him the data, and he said, okay, let's have this conversation later. So later, when we continued, we saw that, okay, we have to really wait for the overall comprehensive plan, because you cannot only do renal diseases. Yep. What about the other chronic diseases? Yep. So he obviously asked Dr. Amin what he can afford. But again, he was also asking for the data. But because we had not completed the whole work, it was difficult for the NHIS to also present the data. Okay. Because at the end of the day, you need the data for. So he said, you go to Parliament and advocate and see if you'll be given something from the allocation. So we met the health committee, we communicated to the health committee, and the health committee said that, okay, I mean, the budget was done last year. It had already gone through appropriation. So look at your corporate social and see if you can get a seed money for maybe 2 million. Okay. Start with it. Okay. So Parliament approved 2 million for us to start with it. So I communicated back to him. Then he said we should continue, because he was requesting for the data, because he, you know, he's a data man. And again, it's the data that you need. Yeah. So quickly, we had to request the data from the teaching hospitals. So what we noted was that, obviously, what Parliament also approved was for the vulnerable. So we got the data for the vulnerable. So when we got the data for the vulnerable, in fact, the 2 million was not even enough. It was about 2.3 million for the vulnerable. That is children 18 and below, and adults or elderly 60 and above. Okay. It was 2.3 million for just that period, that 6 months period, because it's just a temporary measure whilst we rolled out the comprehensive plan for whole chronic diseases. Okay. So the committee we also set up involved Dr. Nsiansari and the facility head, the teaching hospital facility heads, which is the CEOs and their medical directors, and also the patients themselves. The patients themselves. So the patients also said that, you know, chunk of us are between the ages of 19 and 59. So what can you do to, again, on NHIS, you cannot spend when the money has not been given to you. Yeah. We communicated again to government. Me, I can put pressure. So I was putting pressure. Okay. And they said that, okay, so what can you, NHIS, do? So I had to look at the low-hanging fruits in the corporate social, and we got 2.4. So we informed the vice president appropriately, and he said, okay, at least you can start with something whilst we look at the bigger picture. So that is how come the dialysis has come to be. Okay. You see, because at the end of the day, we are trying to help, but you need the data, you need to, and it's not just simple, it's a real study that must go on, so that you know, because you know, once you start, there will be more people coming on board. Yeah. So we needed to obviously get the real actuarials to look at the numbers properly, and before we know money that will be involved. So at the moment we are spending 4.4 million Ghana cedis for the 6 months. For the 6 months. Okay. But I believe that before the 6 months, government will come up with a comprehensive plan to dealing with not only dialysis or chronic diseases, so not only kidney diseases, but the entire chronic diseases.
What's your advice in terms of a comprehensive plan?
Well, I think that's what you see, you know, I do not really want the case that, I mean, obviously, we have to look at it in entirety, like totality, and just come up with a solution. Because today you see, cancer will say add us on. Even though we fund some of the cancers like breast cancer, they will say expand it to prostate, expand it to this. HIV will say do this. Stroke people will say do this. So hypertension people will say do this. So my recommendation is that let's look at it in totality and come up with a solution. One of it is the preventive approach, which will be accepted by all Ghanaians, but we will go a step further. And I don't want to take the shine from government because they've worked so hard to come up. I know from where I sit. So I think let's wait a little bit for government to obviously announce its own comprehensive plan.
For how long?
I think it wouldn't be long. From what I know, it wouldn't be long because there is a sustainable plan for chronic diseases.
And which are the ailments that will immediately be included on the NHIS? Okay,
so for the preventive approach, we're looking at hypertension, diabetes, and I think BMI, body mass index. So we'll be checking your weight and others, which we are working out to see how best it will. And you see hypertension, diabetes, they all have this thing on renal diseases. So
correlation.
They do have correlation on renal disease. So we just want to tackle it head on. But like I said, I believe that the approach of government will be good.
Dr. Dacosta Aboagye, he's the CEO of the National Health Insurance Authority. He is also an external examiner for both the University of Salford and London Metropolitan University for their master's and PhD programs in health service management, health economics, epidemiology, health promotion, and public health. When I return from this break, he'll be telling us more about these portfolios. He would also be sharing his experiences as a cohort leader as a lecturer at the University of West London. He would also open up on his childhood, growing up, his family values and lifestyle. Stay with me, I'm coming right back. Welcome back to PM Personality Profile. My guest still Dr. Dacosta Aboagye. He is the CEO of the National Health Insurance Authority. Dr. Aboagye, straight away, I know you're from the Ashanti region, correct?
Yes.
Where to be precise?
Okay, so my dad comes from Agogo.
Okay.
And my mom comes from Kumau. So I am from Kumau, Bodomase.
Okay. But Ashantis are matrilineal,
yes,
or Mudi or Fade, right?
Edi and Adie.
Okay, and Adie means...
So from the mother's side.
From the mother's side.
Yes.
So your father is from Kumeu?
No, my father is from Agogo.
Agogo. So you, okay, so you are related to your mother, the
my
mom.
mother. So my mother is from Kumau, Bodomase, so I'm from Bodomase.
But you are pure, true Ashanti.
True Ashanti.
Through and through.
True and true Ashanti.
That's interesting. And your parents?
So yes, so my mom is Justicia Frimpong.
Okay.
Like I said, she comes from Kumau, and my dad is Samuel Aboagye. In fact, my dad was a businessman, a high-time businessman.
Okay.
He was a timber merchant.
Hey, then there was plenty money at home.
Maybe when I was growing up. So he was a timber merchant, but now he's very old, about 82, and he's still alive. And my mom was a midwife. Okay. He's also on retirement. They are all with my brother in Agogo. Okay. My brother is a medical doctor.
It's a family of doctors, right?
Couple. Okay. So my brother is taking good care of them for me, so they are good.
You are lucky and blessed to have someone to take care of your parents.
Yes.
But is that where you were born, Kumeu or Agogo?
Yeah, so I was born in Agogo Hospital.
Okay.
That was where my mother was working.
Okay. And that's where she lived with your father?
Yeah, that's where he lived with my father. I think my father got her when she was in school, training college.
At the Agogo Training College?
Agogo Training, yeah, nursing training college.
Okay,
so that's where my mom, the school my mom attended. So my dad was from Agogo, so that's where,
yes.
Okay,
I can see. So you were born there,
yes,
and you grew up there?
Also, I was born there, I grew up there, so I attended my basic education there. It's called APTC, that's Agogo Presbyterian Training College Practice School.
Oh.
So that's the school for the nurses and doctors,
their children.
So that's where I attended.
You were the
so
few privileged ones.
Oh,
I'm sure it was a very good school.
As for, yeah, it's a very good school.
Yeah.
It's attached to the hospital.
Okay.
So it's a very good school. And yes, it was good when I was growing up.
Tell me about it.
Well, I mean, Agogo is a very interesting time. It's very nice. No, but because we were living in the nursing quarters and all those things, that's where my mom
the
was. So we just, I mean, it was good. I mean, if you look at the kind of people that surrounds you, that we grew up with, my friends and all those people, that's the nurses and doctors' children. So we were almost all together.
You were a nurse's son, and your father is a timber businessman.
Yes,
My God.
Yes.
Were you a DB?
What?
Were you a DB?
No, I wouldn't say so. I wouldn't say I was a DB. But I mean, what is a DB anyway?
Or you were Mama B?
Then maybe Mama B. Yeah, because I remember when I visited my mom at the hospital, you know, all the nurses will come and just.
Yeah.
But let's say my father was also living in Accra.
Okay.
So he was, you know, Rollins Park. Yeah. That was where he was doing his timber.
His trade.
Yes. Okay. So I was mostly, obviously, on vacation. I'll come to Accra with him, and when I go back, I'll visit my mom at the workplace. That's at the hospital. Then all the nurses will be happy to meet me, see me. Growing up as a child, like, I mean, what I can remember is, I mean, the group that I was playing with.
Okay.
And like I said, we were living in the nurses' quarters, and the school was just there. So when you close from school, like, you just go and play badminton and all those things.
And you were playing with nurses and doctors' children.
So that makes it more, obviously, funny. I don't know, like, lovely.
Okay.
But again, let me also say that at some point, I had to depart from my dad.
Why?
Yeah, because so when I was in Accra, you know, because he was into business and all those things. Yeah. So I think there were a couple of incidents, but at some point I was on my own.
Okay.
So I have also hustled before. In fact, I was selling at Kantamanto.
Okay, selling what?
Selling shoes, second-hand shoes.
Oh, wow.
Yeah, I was selling second-hand shoes in
I see. So you used to do
something like that.
Kind of
yes.
thing.
So I have a master in Kantamanto that I was working with. Okay. But let me say that to say, my brothers, some of them also went into business.
Okay.
They were following the footsteps of my father,
and
they are very successful in business.
Okay.
So they were also in Kantamanto, obviously, selling those things. So when my father deserted me, I had to run to them.
Why would he desert you?
Well, you know,
how many are you?
So we are 12 in number. Not from one mother, though.
Okay, but okay, your father. So how many from your mother?
4.
4 from your mother, and then 8 from
the other side.
Other women.
Other women, 2.
2 women. Your father is a killer.
No. Well, you know, in the olden days, those things were normal. So,
so why did he have to desert you?
Maybe I was stubborn. I don't know.
Were you stubborn?
You know, Aisha. But let me say that. You see, I mean, you know, the youthful exuberance and all
I know,
those
right?
things. You see, you just want to explore, and also, at some point, I just said, "Well, enough is enough."
And you explored beyond your limits.
Oh no, I'm being honest. At some point, I just said no, so I left home.
Why did you leave? Because your father was preventing you from doing certain things?
Well,
You thought he was sitting on your happiness.
Those are some of the experiences that you have to. So honestly, so I left home. I joined a couple of friends. In fact, I was sleeping in the barbering shop aside. I knew that.
Me.
But I knew that my father was okay, very good businessman. But I think I had my own path, and I think I was okay being with friends and also selling with them
at
in
Cantamanto.
In fact, that's actually taught me a lot.
Okay.
I'm being honest, that taught me a lot. And
what were some of the lessons?
Well, it makes you courageous. I mean, it means that you can take your own destiny into your own hands. You don't really have to depend on anyone for your success or anything. So I'm being honest, that experience was actually worth it.
And this friction with your dad, I suspect that you were the cause.
Maybe, I don't know, but maybe.
He really wanted you to toe a particular line and you didn't want to. Is that the case?
I saw you are pushing me.
Is that the case?
Yeah, all I will say is that, you see, at some point, you see, I think it was youthful exuberance, but I really want to be out.
And sleeping in the barbering shop, you never got into any trouble?
No. You see, I'm also very careful in life. I know what is good for me. So my focus has always been education. In fact, that is why I really believed in the policies of the NPP because of the free SHS. Because at some point, I was also struggling to pay my fees, even though my father was okay.
That's because you were stubborn,
yeah,
so he didn't want to pay for it. It's not like he didn't have.
Yeah, that's what I'm saying. So, and you see, I mean, because of that focus, I took my destiny into my own hands, and I did all that I could to obviously further. But at the time, my mom also supported me, and always I'll go to my mom, and my mom would just give me, you would just say, why don't you come home and all those things. But at the end of the day, you know how
Mommy's boy.
Me, I'm a mommy's boy. That one
know,
too.
right?
I love my mom so much. So, in fact, sometimes during vacations when he asked me to come, I was not even coming anymore.
You're not coming.
I was not coming to my father because at the end of the day, if I come and I'll be selling shoes and all those things, then I must as well be with my mom. But that experience was actually good.
So this is at what age?
I would say immediately after secondary school. Immediately after secondary school.
That's when all this happened.
That's when all this.
But whilst you were in secondary school, you were visiting your dad on vacations and all of that.
One of the things was that, you see, because he's a successful businessman, he wanted to push me into business.
At all costs.
At all costs.
Okay.
And for me, I also, looking at my mom, I really wanted to be
in the health
space.
Okay.
So during the admissions, I think I got admission to Prempeh College to study, I think, social sciences. But I thought at that time he could have gone to the school to see someone so that I could do general science because I did well. And he was not really prepared to do that. At that time, my mom was at, I think, midwifery school. Okay. So I was in Kumasi, and in Kumasi we have our family house in Oforikrom where. So I was one day sitting on the road when I think that time phone was not that common. Yeah. So I think I saw a car going to Agogo and I thought that was my mom. Okay. So I was with my uncle. So I went to my uncle and said, no, uncle, I think my mom has gone to Agogo. So let me go to Agogo. My uncle says, no, your mom he would have called me.
To tell me.
So I said, okay. So I rushed to Agogo. And when I rushed there, so I narrated all the story to. At the time, because she was going to the midwifery school, she was also in this, so he handed me over to my uncle. Yeah. And my uncle spoke to my dad. My dad said, no, you have to be in, I want you to be taking care of the business for me.
Okay, so you don't have to go to the Prempeh College?
Exactly, I don't really have to go to school.
Okay, he didn't want you to go to school.
Yeah, that was how I felt. Maybe he just wanted me to wait or something, I don't know, but that was how I felt. So I said, no, I wanted to go to school. So my uncle took me to Aboagye,
Yeah.
and I was admitted in the sciences.
Okay.
And so at the time, Prempe had already, I mean, they had already gone to school.
Oh.
So since that time, I had this thing that, no, I don't think I have to be with my yes. So one of the holidays, I came to visit my dad, and when I visited my dad, oh, it was not good. That was when I left home. I left home, but
the pressure was too much for you.
No, it's like, you see, your uncle has actually done what obviously
he should have done. Okay.
But let me say that we reconciled. So he was visiting me in school.
Okay.
And again, when he was visiting me in school, I still had the experience, some bad experience. So yeah. So the friction was actually, but I love him so much. He's still alive, like I said. You see, but like I said, I think maybe if I had gone to business, I could have taken over his businesses, and his businesses might not have gone down.
But that wasn't your passion.
That wasn't my passion. My passion was education and education and education.
Okay.
And today, when I look back, I think I made the right decisions, and he's proud of me. You see? So all that I'll say is that, you see, regardless of the circumstances, if you focus on something and you want to do, you can do it. You see? And I'm being honest, you can do it. And I mean, as we go on, if I share more insights on my education with you, you'll see where I have come from. Since that time, I took over my own education. I financed my own education by the work that I do.
Right.
To the extent that I went to the university abroad with my own resources.
Tell me about it.
Yes.
But first, let's talk about Aboagye SHS. How was the experience?
Well, that place too was good. I think, you see, during those times, I think we were teachers. We were short of teachers and all those things. So you see teachers taking 2 courses or 2 classes and all those things. So we were struggling a little bit. But again, I will say that I was one of the few people who passed and passed well. Okay. I was a very committed Christian there. So SU.
Okay.
Yeah. And obviously, always in the library trying to, like I said, my focus was education.
You were smart and intelligent.
Yes,
student.
very. And the teachers also liked me. So when I don't understand anything, I will probe and ask the question, and I'll find the answer. Okay. So that became obviously mine. That became my motivation in terms of what I really wanted to achieve. And always I was saying that I really want to be a doctor. I want to be a doctor. Okay. And so I really purposed it from the beginning that I wanted to be a doctor. And I'm a doctor, though not a medical doctor, but I'm a doctor.
That's interesting.
Yeah.
And in Aboagye, like you said, your uncle took you there.
My uncle took me to Aboagye.
He stopped paying your fees. He stopped providing for you.
No, not necessarily. You know, because my uncle was taking care of me, and because obviously, like I said, when I come to my dad's business, but because of that friction, immediately after school, immediately after the secondary school. That was where the tension became.
You parted company.
I parted company. So that was I parted company. That was when I was sleeping in the
barbering shop.
Exactly.
You told me more about that barbering shop.
With my friends, anyway.
So, but at Aboagye, so your uncle played a role?
No, in fact, I would say my dad still paid the fees at Aboagye with my uncle. Okay. So, but like I say, if you see tension, you know. Yeah. And my mom was also there, so I didn't really have to. You didn't
really struggle. But then when you come to Accra, you had to also do these menial jobs. Selling the second-hand shoes. Who introduced you into that?
Yeah, so one of my father's children is a very successful businessman in Cantamanto. Okay. In fact, he's well-to-do, I must be honest.
Tell me about it.
So at the time, because we were young, he was into that. And he said, no, you don't worry, just once my dad was into timber, just come,
Yeah,
just
it's
so
the same area.
Exactly, it's the same area. But you see, when we finish work, they will go home and I will go to
the barber shop.
My friends.
Sleep there.
I go and sleep
He didn't
there.
know you weren't sleeping with your dad?
No, but they go to my dad because at the time, yeah, so
they were still living with your dad.
Yes, they were still living with my dad in my dad's place. So I didn't want to be there.
And they couldn't step in to resolve this friction.
I didn't want to be there. So it's me, it's not them.
You see why I said it's your fault?
Yeah.
Okay, but
so,
at Trinidad Aboagye, describe the environment, the discipline, the teachers,
I
the
must
learning and teaching
I must say
environment.
that, you see, Trinidad Aboagye was good.
Okay.
Again, that's one of the places that they instill discipline. And when you finish that school and you are not courageous, then I don't know.
Okay.
You see, you know the history of the Kumaus, where our king used the head to sacrifice or something for the entire Ashanti. So you are taught boldness. So we at Shrema, so we are not really afraid of things.
Okay.
But I think it was one of the good experiences I've ever, and in fact, I visit them often nowadays. It was one of the good experiences that I actually had.
So what kind of a student were you? A studious student or?
Very, very serious.
Okay.
Very serious. Like I said, always in the library, always SU, always Krife. Krife. Yeah. I still have that in me.
So you never got into any trouble at?
No. I run away from trouble.
When it's coming, you'll be running.
Away from
what
trouble.
if it chases you?
No. You can, in fact, you can check my history there. I was that calm, always looking for books to read.
Okay.
Yeah. So, and when I'm not in SU, I'm actually maybe sleeping, or so I was very calm.
There was no peer pressure?
No.
Really?
Yes, no. I'm being honest, no.
Okay.
Yeah.
But what challenges in Trinidad Aboagye?
The fact is, you see, the good thing is that, you see, because I also come from Kumau, the extended family were there. So if I needed anything, I would just go to the extended family.
Okay.
You get what I mean?
That easy.
It was that easy. And I was saying, my mom's sister, she's also very old now, about 90. She also took very good care of me when I was there. So I didn't have much challenges in Trinidad Aboagye. But again, you know, water challenges.
Yeah.
Obviously, you have to go and fetch the water carrying the bucket. So we were just going to river or something, just fetching the water. Then we just come and use it to. And obviously, the first year, they will bully you a little bit.
Exactly where I was coming to.
But, I mean, it was cool. It was cool. You take your provisions there, they will take it before you.
They took all your provisions
from you. Oh my God.
Especially the calm ones.
Yes,
they bully you a lot.
Trust me, they will take all the provisions. Again, one of the extended family members was a teacher there. So always I'll run to his house. May his soul rest in peace. He's dead. Yeah, so always I'll run to his house. So those were some of the things, but it was good there. I got a very good training from Trinidad Aboagye. Yeah, very good training.
What were some of the bullying that you still remember? Because I know you will never run away from that.
Kneel down.
Oh, just that one is normal. Just kneeling down. You didn't read? You did not read?
Oh no, as for weeding it, we do a Greek, so that was part of this thing. But you know, I always stay out of trouble, so I cannot remember if I was punished to go and weed.
And when the seniors come, you just hand the provisions to them.
Yeah, we give it to them, then you are okay. Once you give it to them, you are okay. So from Trinidad Aboagye, I came to Kumasi Polytechnic, where I did pharmacy technology. I was there for 3 years. Then immediately after that, I went to Cape Coast University with the intention of doing my medicine. But I said that I wanted to be a doctor. And they were offering that when you get to the 3rd year, you will do medicine. But
But
when
what
we
do you
got to
start
the
with?
third year, so we start with the general sciences,
science, okay.
then biology, chemistry, physics. But when we got to the third year,
Yeah.
the school was not ready for the medicine. So we
Okay.
had to branch into chemistry, human biology, and others. But looking at my background from the pharmacy, technology or technician program, I opted for chemistry.
Okay.
So I did chemistry. But I still had the case, I still had it at the back of my mind that I wanted to be a doctor. So it was there at the university, but because I had finished the Kumasi Polytechnic, so I did my service with the pharmacy technician program at Cape Coast Teaching Hospital, which is in Tabetin. So I was working in the pharmacy while school. Sometimes I would do 9 shifts, and that's what I was saying, that from there I took care of my own school fees and other things with the support of my mom and my dad. Was, I mean, once a while I'll just go to him and just take some money for my school fees. But I must say that I mean, you see, all those experiences actually shaped me to be who I am today.
Okay.
Yeah.
And then from the University of Cape Coast, you went to Lead Beckett's
So from the University of Cape Coast, immediately after school, I was lucky. I got a job with Paracelsus Pharmacy, which is in Osu, Alcon. They had this, they specialize in eye products. So they had this consortium that, so I was a medical rep. So once repping, once doing so, you go to the various hospitals, meet with doctors, and obviously sell your products to them. So once doing that, I was still, in fact, I was in charge of, I think, Nigeria, Ghana, and South Africa. So once doing that, I was still planning to be my doctor that I wanted to be. So at some point, I decided that I wanted to go and do my master's. So I got admission at Leeds Beckett's. I had saved some money, so I went myself and I paid. And once I converted my pharmacy technology program here in the UK to what we call medicines management. So I was working with the NHS, so I was earning some money whilst doing my master's degree. So I'll earn the money and use it to pay my fees. Then immediately after my master's, in fact, I did very well in my master's program. I did very well. So my supervisors actually liked me. Then they proposed that, will you be able to do a PhD? And I said, yes, I can do a PhD, but I don't have funding. So they waived the home student cost for me. So I had to pay, because I was an international student, so I had to pay the difference. But knowing very well that I was actually working, I could pay. So I will work and pay. I will work and pay for 5 years.
Wow.
Until I finished.
That's a determined student.
Yes, for 5 years. I paid it myself.
Wow.
Yes, so I'll work, but the work was good. You see, let me be honest with you, because I was in the consulting room with doctors, advising them on contraindications, and it was well paid in the United Kingdom. Not only did it boost my profile, it gave me a lot of experience. You see, so immediately after my PhD too, I got work as a fellow at the Leeds Beckett University. As fellow is like a researcher. So I think six months into that, then I applied for a job in West London, and they took me as a full-time lecturer. After 1 year, I became the course leader.
Wow. You're an intelligent guy.
After 1 year, I became the course leader. And I became a fellow of the Higher Academy of Wales and England and Wales. Yes. So that's also one prestigious thing that I did. So, I mean, I started publishing a lot of my PhD work, and I became an international consultant to the extent that I was consulting for Ghana. So I was consulting for the Ghana Health Service. So it was 2016 that through the consultancy, I came to Ghana, helped the government to set up the health promotion division because it was a small unit.
Yeah.
So it took some time through UNICEF and WHO. So I think we completed the work, I think, in 2019 when it became a full division.
Yeah.
Yes, so now in Ghana Health Service, we have the Health Promotion Division. Then they advertised it. Then I applied for it. No, I wanted to be the director there. Luckily,
You got it.
I got the job. But obviously, you know my experience as well and my background. So yeah, I was not really surprised that I got it. And when I came in 2019, December, COVID also came.
COVID showed its head.
COVID came and the president called some few experts in the room. He formed his task force. So myself and Honorable Opon Kroma was asked to lead the risk communication and community engagement of the pandemic management.
Those were very critical moments for us.
Yes.
What was the experience like?
Well, it was tough. You know, you come to work, you not go home. For 1 week, we did not go home.
Really terrible.
And I could see my staff, myself, and all the team working so hard, sleeping there, saving lives. Wow, it was, in fact, that
when
was
you yourself, your life was in danger.
You yourself, your life was in danger. So I think, but we executed the work very well. And this is where I would say that, you see, President Akufo-Addo is bold. I'm being honest. During those times, we could stay in that meeting for a very, very long time. You know, he was the chair, taking decisions that, tough decisions. Yeah. It was not easy. And you know, this disease has not happened to us in so many years. So it was really difficult. And it was novel. So we needed to really navigate. Yes, we really needed to navigate.
It was really scary.
Yes, to the extent that the economy was shut for 2 weeks. You remember?
I remember. We went for lockdown and I mean, just less than a month, we just couldn't, nothing was moving. I mean, it was a terrible moment.
It was, and I think, I mean, it's not surprising that he rewarded all the nurses and the team because it was very tough. It was very tough. Like you said, at the peril of our lives. We were at the forefront. But again, the media was also there because we were working with you.
Yes,
you remember?
So, easy.
I mean, it wasn't easy for all Ghanaians. That is what. And the country went through a lot of difficulties. So for me, I think those were the moments that, and I think we need to tell the story very well because Ghana was one of the few countries that actually succeeded in managing COVID. In fact, when I was in the UK, I was asked, who was that white man in that place guiding you? So they were thinking that obviously there were people from abroad who came in to help because Lancet actually put Ghana's COVID management second place with South Korea.
Wow. We did that well?
Yes, we did that well. In fact, we were one of the few countries that managed the COVID very well. When you talk of our case fatality, when you talk everything. So we did very well. We did very well. And our approach was good, all society approach. All society. So it means that everybody should be on board or was on board.
To be on board. There was a collective
responsibility led by the president. In fact, those were humbling moments, that's why I salute him for the whole team. You see, like I said, if you were not part of the committee, you really will not understand. Because sometimes we have to stay midnight. And by the time you realize the president is calling you for a meeting, he's calling all the members. But sometimes you have to go to Peduase.
In the night.
Trust me, in the night.
Wow.
So it was not easy.
It wasn't
easy. It wasn't easy.
Well, we're happy that all the decisions you took helped us, and we pray we never go back to that situation because it was really unpleasant. But you have 11 impactful research works in health promotion, public health. Share with me highlights of those researches.
Okay, thank you. So I have published my work internationally with high impact factor journals. So some of them are on the National Health Insurance Scheme, taking it from an equity perspective. Some of them are on out-of-pocket payments. Some of them are on the whole policy of the National Health Insurance Scheme and how it can be reformed from a community perspective. So those are research work that's, in fact, those are some of the things that I'm trying to implement. Because obviously, you know, as a PhD student, you really, or as a PhD, someone who has gone through the PhD, you really want to implement the things that you came up with. And those gaps still exist. So that's why you see, I told one of your colleagues that it's like a doctor doing surgery. That's my specialty. So you cut here, you know, when you cut here, you save lives. So you cut here, you cut here.
Yeah.
So that's exactly what I'm trying to do.
Okay.
Yes. But I think, so maybe I have to now begin to now do a collection of my research papers to see if I can become an associate professor or a professor. Because
very important.
I do have a lot of publications.
It's very important.
Yes,
it's very important. But now you have a lot of work at hand, though.
Yes.
So I don't know how you're going to do this. But of course, it's possible.
It is possible.
It's possible.
It is possible. You know, one of the things that I'm proud of, okay, is the COVID experience.
Yeah.
In fact, it brought me to the limelight. And it taught me how to be toughened in hard times.
Yeah.
And you see, in leadership, you see, you have to bring everybody on board because we worked as a team during the COVID. And it's those things that, so I'm happy that I came in at that level. And now the president appointed me to lead the institution of my choice.
Okay, which is your
my area.
It's your area.
It's my area.
So you're very comfortable.
Yeah, so I'm very comfortable. But those experiences have actually shaped me so much that you see now I'm able to look at it and say, okay, you see, now how do you bring people on board? You see, because knowledge do not reside in only one person.
Yeah, definitely.
Exactly. So that's why if you check carefully, since I came in, 2 committees have set, one chaired by Dr. Aboagye, the other chaired by Dr. Nsiansari. Dr. Nsiansari's committee is the dialysis committee, which we have now finished, but we do have the plan. Then Dr. Aboagye's committee is the preventive medicines committee. So I believe that, you see, when you bring a lot of stakeholders on board, you are able to achieve success. So the first thing I did was to engage various stakeholders to look at the problems within the scheme to see how best. That has actually been very successful, and I think the stakeholders are very comfortable. So when they come, I share my ideas with them, and they will now profess the solution. Okay, if you do it this way, it will be. And it's the same way that we are going, because by that, you are able to inculcate their ideas into what you are obviously doing. So it's really been good.
A lot of work you've done over there. Let's talk about your recognitions, and you've received a lot of them in citations, including the MTN Young Professionals Role Model in Health. That's the gold category, the Golden Citizen Award 2021, the overall National Best Health Leader of the Year 2023, and even the Order of the Volta for your contributions and sacrifices during the COVID-19 you just talked about. How does all of this make you feel?
In fact, I will say that, you see, looking back, this is why I'm so proud of my mom and my dad and my uncle for investing in me. Because at the end of the day, and I'm proud of myself as well, because at the end of the day, you see, I would have been in business. Maybe I would have been a good businessman. But you see, looking back at where I am today, like I told you, I believe that I took the right decision. Because
you followed your passion.
I followed my passion. This is why parents should not force, obviously, their children to do things that are not within what they want to do. Let them follow their own path. When they will make mistakes. I mean, we all make mistakes in life, and you correct them, you guide them. You are not there to enforce your this
impose
thing
on them.
on them. You see, so that's one of the lessons that I took from myself and my dad. You see, because at the end of the day, but like I'm saying, we don't know the other version. It could have been very successful. Maybe he also wanted somebody to take care of his business, and he believed that it was me.
Yeah.
You see, so again, like I said, since I came in 2019, I have done my best. I was not expecting any recognition, but I think God is the one who actually gives recognition. I have had a lot of recognitions, some of which are those that you mentioned. But let me also say that even when I was in the UK, I had, in fact, when you come to my house, I have a lot of citation, plenty. From 2015, now I've had a lot of hard work. That's a sign of hard work. So if you work hard and follow your dreams, definitely you will achieve. That's what I know. And I've still not finished.
It's just the beginning.
It's just the beginning. So I'll just continue to press hard and just focus on the things that I want to do and see how far God will take me. But again, I'm also thankful to God for life and health, because at the end of the day, without those two, you cannot utilize the knowledge that you have. Let me at this point also pay tribute to some people who have actually influenced my life very, very well. So when I was in the UK, the person that I went to, we called her Mama Stella. Mama Stella is it's like my mom's friend, something like that. And when I was going to the UK, I didn't know anyone. The husband is a pharmacist, so they took me, and I was staying with them. It became, then I also stayed with one Uncle Kobo. He was not a family member, but that's how, may his soul rest in peace. So when I went to the UK, we became family there. Then I met my mom, a chief of staff of the Republic of Ghana through politics. In fact, she has been very instrumental in my life, and I love her so much.
Oh, Frema, this is for you.
Yes. You see, when I have challenges, I'll just go and just be telling her, Mom, this is what, then she will advise me. You see, so she's been my rock. I'm being honest. The Bible says give recognition to where recognition is due. I must say that she's one person that I cherish so much. Now, I'm part of the family. I'm really part of the family, and they don't joke with me. So I'm really, really happy. One of my children is named after her. One of my children is named. I have three. One is Freeman. All the names.
Frema Ofari.
Frema.
Is it Dacosta in the middle?
Okay. I don't know if she will want me to say it, but I'll say, you know, my daughter was born on a Tuesday, so it's Abna. Then I wanted to do Akosia. Then he said, no, but no, me, I'm Abna. So no, don't change it, keep it there. Maybe I don't know if she wants me to say. So I gave all the names. So Abna Frema Ose Opare Aboagye.
Wow.
And there's a Christian named Jovel for her.
This is enough.
And you know what? Her behavior, everything is like
Oh, really? Okay, so names do really have an impact or influence on children.
Yeah.
Oh,
being
wow.
honest.
She'll be a great woman.
Very, very, obviously like a Madley, something very, you see, very independent. She really wants to take charge and do her own things. Oh my God, I love her so much. Yeah, she's the last one. Then I have two boys. I have Jojo, Jotham Aboagye, and Jedediah Aboagye. Yes.
And I'm sure wifey has also been very supportive along the line.
Yes. She has been very supportive. Yeah.
Thank you so much, and we really appreciate your efforts, especially during the COVID-19 era. All the risk that you took, we recognize them, and the new fresh air that you've brought to the NHIA. It's refreshing. So thank you for what you've been doing.
Thank
But
you.
I must also say, yes, I'm not surprised. You are a health practitioner, so you look healthy.
Yeah.
What do you do to stay fit?
Okay, thank you. So I do a lot of exercise. I preach what I do.
Yes, you have to.
So you see me, I live around Abri. So Saturday morning, you see me walking up and down. I do a lot of, obviously, in-house press-ups and those, just to keep fit.
Okay.
I make sure that I obviously eat a lot of fruit as well. Though my eating habit is not that good because of the work that I do.
Yeah.
But I try to eat very healthy. Yes, I think those are some
So
of the things.
which of the exercises are we doing together? Are we climbing the pre-mountain, or we're going to the gym, or we're walking? Which of them are
I think
we
we will
doing?
walk. We will walk. We will do walk. We'll walk.
We'll
Walking
walk
is good.
together.
We'll walk together.
Viewers, I get to walk with him. Maybe I would also become a doctor. A professor of health. Dr. Aboagye, I'm grateful that you made time to speak with us, but do you have a leisure time with all this on your plate?
I do.
Okay.
You know, when I was in the University of Cape Coast, the Atlantic Ocean is actually there.
Yeah.
So in my quiet time, I'll just take a book, just go and sit the beach and just be reading.
And be reading.
In fact, even in Accra, sometimes I do. Sometimes I just need time for myself. Let me say something. You say, regardless of how busy I am, my health is very important to me. It's my number one priority. I take holidays.
Yeah.
You can ask those from Ghana House Service. I'll always take my holidays.
I think it's a UK training.
Yes. I'll always take my holidays. I will
Very
never miss my
important.
holidays.
Very important.
So within the year, I'll take my holidays. I'll just go somewhere and just be cool and just get free, like air, nice air. And when I come back, I'm fresh.
Re-energized.
Re-energized. And I keep going. But when I'm working too, I work.
Yeah.
One thing that I was saying, you know, because of the work too, sometimes you close very late.
Yeah.
You close very late. So my sleeping habit has actually not been that.
Yes,
that's why I make it up when I have to. Yeah.
And what's the time for family?
So it's my holidays for family.
Okay.
Yeah. My holidays for family. So I actually, like once I take my holidays, I go to my family and we have time together. So, yeah.
Okay. What do you do to relax after a hard day's work?
What do I do to relax? Maybe reading papers.
Reading newspapers?
Yes, because that's the only time I get to read.
So to catch up? To
catch up. That's the only time I get to catch up. But, yeah, I think it's and reading. I only read.
You like to read?
I read, yeah. I know there's a lot of pressure in the work. So I intentionally, and you see, sometimes you hear my staff saying that, no, you need to take rest. You are tired. You need to take rest.
Important.
Then at that time, you see, I'll stop everything and just
take the rest.
Exactly. So yes, it's. But you see, one of the things is that if you look at my trajectory. Since I completed school, I have always been in leadership position. Okay. So this is not really new.
You've been blessed.
Yes, I've really been in top leadership position. In fact, there's one thing I've not talked about. You know, during the COVID, I became the chair for the ECOWAS Risk Communication and Community Engagement.
Right.
Under the Economic Community for West Africa. Okay. Under Disease Surveillance and Control. In fact, it was just recently that someone else took over from me.
That position.
Currently, as we speak, I'm the chair of the African CDC Risk Communication and Disease Control. Okay. Today, I chair the board meeting. Wow. Today, I chair the board meeting. Wow. So, you see, I try to, it's all time management. And I believe that when you focus on something that you want to do, you have to. And this is where I would say that you're saying it's time management. Yeah. In Ghana, we must take our time very serious. When you give me an appointment, I'll try to be there the same time. Those manners actually, or those habits actually help. If I can't make it, I'll phone you and say that, oh, I can't make it because of A, B, C.
Yeah.
Those are the kind of habits that I think I have actually learned that is really helping me. Yes, and when my work, like if we start work at 8, I'll be there at work. You can ask my staff, no matter when I leave the office, I will still be there.
You have to be there. Wow. Wow, and of course, I mean, the workers have no excuse if the boss himself is there at the right time.
At Health Promotion, I instituted something, the clocking system, digital clocking system. So we realized that when they were coming to work, you see, they were having challenges. So we gave them, let's say, 30 minutes more time to come to report to work. So I will get there first, but I expect everyone to. And there was discipline. You see, I'm being honest, there was discipline. People were coming. And if you are traveling, you have to fill in the travel form. Other than that, you will not go. If you can't come to work, you need to. So I thought I brought discipline in that division. And it was really working very, very well. And I hope they are continuing because, yes, I'm being honest. Those are the things that we need to do to make sure that our country actually develops. Because at the end of the day, you are being paid for it. And if you are being paid for it, then you need to. Exactly. So for me, I believe that there are certain things that we need to do as a country. Those are some of them that I have, the habits. We need to reset our mind. Our mindset is very a change in attitude. And mindset change and behavior change is very, very important for our development. And we shouldn't obviously just cross over it.
Thank you so much for your contribution to the health sector. Do you listen to some music sometimes?
Yes, I do.
I mean, Shakespeare says, he who does not love music is not fit to live.
Yes, yes.
What genre of music do you listen to?
I'll say the Christian music.
The Christian music.
But more recently, I've tried to obviously learn the new ones that are coming up. So you see that sometimes I'll just be in the room alone and just be dancing. Bugal.
Tell me about it.
And sometimes I'll just be like
you need to spice your life.
Exactly. So that's how I release stress as well.
It's very important.
So you see, I'll just, on Saturdays, I'll just put the music on and just be in the room and just be dancing. Just be dancing.
So which one is your favorite? Which is the latest that you've learned how to dance?
There is one that touches me because I think it dwells on the vulnerable. It says, "Se me." Thank you, Aisha.
Really appreciate your efforts in trying to make Ghana become one of the best when it comes to health delivery. And we thank you so much, especially with what you did with COVID-19 and what you want to do with NHIA. Thank you so much. And viewers, thank you so much for watching. Same time next week, we'll be bringing you another beautiful personality on PM Personality Profile. My name is Aisha Brian. Do enjoy the rest of our program. At Cantonment, so you were selling shoes?
I was selling shoes at the time. I'll just be clapping my hand.
So,
no shining high. Oh, I've done it. In Agogo is a town, and I mean, we know each other, and it's a small town. Those days, I'll write letters to Cheche Kule. A lot of times, my letters were read.
Okay, that means they were brilliant.
Agenda is unity. So we are called fellows. And what normally happens is that, for example, if I go and do something wrong, my fellow custodian would never disown me. Aside all the falling and everything, check the grace of the custodians. First class. I remember one time we invaded Katanga. So
you did?
Red soldiers invade Katanga. Not only Katanga, we also invaded Commonwealth.
What have you brought about that?
Okay, so you know we have some common games that we do. So we were on a bus naked.
I see.
Coast to
Kumasi.
Kumasi, sometimes to Legon.
Naked.
So I remember, of course, I remember one time we got to Winneba on the bus and we started just playing this thing and everybody was naked and we just had to rush to the bus.
My God!
When we got to Legon, from the gate, you know, University of Ghana gate,
yes,
to Commonwealth.
Okay.
Oh my God. Great Kisley Hayford Hall.
Okay.
We love and serve you evermore. And as we live in unity, great and courage shall be our strength. Cast forth, cast forth. We salute you. Cast forth, we honor you. Mother, cast forth. You are the greatest, the supreme, and the best. Cast forth.
Yeah, Shabre, nah, yeah. Yeah, Shabre, nah, yeah. Say, oh, Shana, say, oh, yeah, Shabre.
Ebedi echi o, na ohun betri o, yeah,
Shabre, nah, yeah.